I'm joined by Dr. Jennifer Thomas. Dr. Thomas, a board certified in both family medicine and addiction medicine. She led the implementation efforts in building a collaborative care program at Morris Hospital and is the director of integrated behavioral health at Morris Hospital. Dr. Thomas completed a primary care psychiatry fellowship in 2018, and her clinical areas of interest are treating behavioral health and substance abuse conditions. She sees patients in her Braidwood and Gardner offices. May is Mental Health Awareness Month. We want to spend a little bit of time talking about all things mental health. And I guess we'll start with, tell us, what is integrated behavioral health?
Sure. So integrated behavioral health is addressing behavioral health conditions in the primary care setting. So most patients, when they enter the healthcare system, start with their primary care doc, someone that they've known for years that treats them for their medical conditions. So integration is this concept of bringing behavioral health services. Our mental health and physical health conditions are intimately connected. The mind and body don't exist in a vacuum, and where both issues are, intimately connected. So if we can address behavioral health conditions alongside physical health conditions, we find better outcomes for the patient, and patients find that they improve quicker if they can have all those things addressed in one primary care setting.
All right. Well, what are some common signs of behavioral health conditions?
Sure. So, when we think of behavioral health conditions, the first things that come to mind probably are depressed mood or tearfulness, maybe anxiety or panic attacks. But other symptoms can also signify or tip us off to mental health conditions. So changes in appetite or sleep. Sometimes someone's energy level, they might present with fatigue or even musculoskeletal complaints like sore neck or sore back, or even GI symptoms of abdominal pain can also present with mental health conditions. So there can be a lot of overlap.
Yeah, sounds like it. Well, what types of conditions can be treated with the integrated behavioral health approach?
Yeah, so with integrated behavioral health, we take all comers, because in primary care, we see all things. Everything walks into our door all day, every day. So certainly depression and anxiety would be the most common conditions. But with integration, by having a care team member that is a behavioral health care manager, so that's bringing a social worker or a counselor into the primary care office, and then a psych consultant that helps the primary care doc diagnose and make treatment recommendations, the team can address those behavioral health conditions together. So it's a really powerful model, and it can help us uncover additional conditions such as PTSD, maybe even substance use disorders. So yeah, it's a nice model to address the whole person.
All right. Well, what's the first step in getting help or guidance from a medical provider?
Yeah, so I would encourage patients, if they're interested in integrated behavioral health, to reach out to their primary care provider. In the Morris Hospital system, we now have the collaborative care model at 8 of our primary care sites. We hope one day that it'll be at all of them. We're doing what we can to, increase implementation and dissemination of the model out to reach more people in the community. So yeah, first step is call your primary care provider. Even if they don't have the collaborative care model, a PCP is going to be a good starting point. They can often address many behavioral health conditions in their office, and if not, they can point someone in the right direction to help people get the care they need when they need it.
Dr. Jennifer Thomas with Morris Hospital and Healthcare Centers. As we've been discussing, May being Mental Health Awareness Month, Morris Hospital is known for its compassionate and personalized approach to healthcare, with 1,450 employees, including a medical staff of more than 200 physicians and advanced practice providers who stand ready to improve your health at 28 convenient locations. To learn more about the locations, services, or providers near you, visit Morris Hospital's website at morrishospital.org or call 942-2932.